The information provided in the following program is not a substitute for or intended to be medical advice. Medical advice can only be provided to you by your personal physician.
Another turning point, a fork stuck in the road. Time grabs you by the wrist, directs you where to go. So make the best of this test and don't ask why. It's not a question but a lesson learned in time. It's something unpredictable, but in the end is right. I hope you had the time of your life.
Natural Health Consultant. I really love that song. I think I never get enough of hearing it. I like the idea of the time of your life. It's a beautiful idea. Let me introduce myself if you're listening for the first time. I'm a local graduate of New Brunswick High School, Rutgers University, and Western States Chiropractic College, which is not local. It's out in Portland, Oregon. For the past nearly 40 years, hard as it is for me to believe, I've been studying natural health and functional medicine and functional neurology. I really enjoyed our show last week, and I got a number of questions from a number of people I saw afterwards and things that they were interested in having us speak about. So I'm going to use those topics and those questions as a way to introduce some new ideas this week. So whether you're listening in the car or at home or in the office, I hope you enjoy. And if you have questions, feel free to call at 732-545-9282. That's 545-WCTC. And hello to all of you who are watching live on Facebook. I'm glad that you have tuned in and joined in also. So the first topic that I want to talk about, which again was prompted by somebody's question, has to do with blood pressure. You know, blood pressure is a major issue for people. I know because people come in all the time and they want their blood pressure checked or they're concerned about it being too high, although I have to tell you that being too low is also a problem, which maybe we'll get to. But the predominant problem that people wonder about is their blood pressure too high. Will it lead to a stroke? Can it lead to other problems? And what can they do about it? So first, let's just think about it. You know, the blood pressure is really an issue of the heart. Much like love, blood pressure is an issue of the heart. So what really is the heart? Well, the heart is an incredible yet very simple organ. The heart is a pump. Although we've learned in recent years that there are also chemicals and hormones that are excreted by the heart, basically the heart is a pump. And the job of the heart is to pump blood throughout your body. I think we all kind of have an idea of that. So it's very simple. The question is, so then why does so much go wrong? Because we know that heart disease and blood pressure problems are a major cause of illness and unfortunately even death in this country. So let's just think about it logically. So you have a pump which is pumping fluid throughout the body. There's really two basic things that can go wrong, and all of medication is pretty much based on these two things. One is that the fluid, which we call the blood, that the heart is pumping, can get to be too thick. And if the blood gets too thick for some reason, now the heart is going to obviously have to pump harder. And the other possibility is that the area that it has to pump through could get narrowed. So we know that the heart pumps through blood vessels. And if those blood vessels for some reason become too narrow, wouldn't it make sense that the heart is going to have to pump harder? So if either the blood is too thick or the blood vessels become too narrow, those are the two predominant reasons that a person would have high blood pressure. So, sounds pretty simple. What do we do about that? Well, there are a number of medications designed, and really they're all pretty much designed to help with those two problems. For example, one of the first things often given is a diuretic. A diuretic will lower blood volume and take some of the pressure off the heart. Another classification of medications are called ACE inhibitors and calcium channel blockers. And although there are variations between the two, I think we could be safe to say that the way that they help blood pressure is by dilating or making the blood vessels bigger. So you think of it like a traffic jam. If you're trying to go down a 2-lane highway and you've got too many cars, everything gets stuffed up. Well, it'll be much easier if we change that into a 4-lane highway, and that's pretty much what we want to do when we open up the blood vessels. We want to make it easier for all that blood to flow through. Now, medications are essential, or actually what's essential is to correct the problem. The question is, are there ways to do it in addition to? Of course, I'm not recommending anybody run out and stop taking medication. As I tell people in my practice, by the way, I am at High Point Health Center in Highland Park, New Jersey. I forgot to mention that. If you're on medication, you're on it, I'm sure, for good reason. And if you're going to make any changes or want to make changes, you should always discuss it with your prescribing physician. But I want to discuss some alternatives for you. So one basic alternative is that there are nutritionals which can be used, both minerals, vitamins, and herbs, which can be used to not necessarily thin the blood, but clean the blood. So if you've got blood which is too thick, it's not too thick because you have too many vitamins and minerals in your blood. It's too thick because you have too many toxins in your blood. And toxins are easy to come by in this world, not always so easy to get rid of. So there are wonderful, very effective natural ways to rid yourself of a lot of these toxins. And once the blood gets thinned of these toxins, then the blood pressure can naturally lower itself. Because I want you to think about this. When blood pressure goes up, don't we want it to go up? I mean, it's essential that blood reach every part of your body. And if your blood has become too thick with toxins, I think we want the blood pressure to go up. Because if it doesn't go up, you're not going to get blood where it needs to go. You're not going to get, for example, oxygen to your brain or nutrients to your feet and so forth. So blood pressure gets a bad rap when it goes high. It goes high because it's trying to compensate for a problem. So we don't want to just artificially lower the blood pressure. We want to fix the problem or the reason that the blood pressure went high in the first place. So one thing we can look at is somehow cleaning up your toxic intake and also cleaning your body for the toxins that were there. That's issue number one. Issue number two brings me to something which is very exciting, which I've recently found in my office, and that is what happens when your blood vessels become too narrow. So again, think about it. Your blood vessels have become too narrow. If that happens, don't we want your blood pressure to go up? I think we do, right? We want the blood pressure to increase, again, because if it doesn't, the blood's not going to get to where it needs to go. So the blood pressure going up is a good adaptive mechanism of the body. What's bad is that your blood vessels have become too narrow. And there's all kinds of medications that do that. But I have great news for you in that there is actually a very natural, safe way to increase the volume and increase the width of your blood vessels. So now, if you were here last time, you know that I told you a requirement of listening to this show is that you have a pen and paper with you, and I hope you remember then that you brought it. I'm going to let it go if you're driving. I don't want you to be doing this, writing it down if you're driving. If you're working, while you're listening, you can kind of do this off to the side, because I want to tell you an incredible natural way to dilate blood vessels. It's a product called taurine. I'm going to spell it for you, Taurine. So taurine is what's called an amino acid. It's a natural building block in proteins. And you get plenty of it in your diet if you eat protein. However, if you have narrow blood vessels, you're not getting enough. This came to my attention when I saw a study published years ago in the Journal of Circulation, which showed, now get ready for this, that people who took taurine had the same volume of width in their blood vessels as smokers. So actually, and I have a few people in my office who just won't quit smoking, which they need to do for many other reasons, but I tell them at the very least, if you are smoking, you must take taurine daily. And I have seen people in my office who have had very stubborn high blood pressure on medication, not going down, taking the appropriate amount of taurine, and in a matter of 2 weeks, their blood pressure came down. Not because we artificially lowered it. Remember, we do not want to do that. But because the blood vessels became dilated naturally, with no side effects, and then their blood pressure could drop. So we have discussed two of the three main ways in which blood pressure would go up: thickening of the blood, and we talked about how to handle that, and narrowing of the blood vessels. I just gave you an incredible way to do that. The other reason blood pressure may go up is due to stress. I'm not going to talk about that now. In fact, in a moment, we're going to take a quick break. But we're going to, later on when we have our mental health moment, we're going to talk about ways to reduce stress, which would also be a third way to help lower blood pressure. So I hope you got our first lesson, lowering blood pressure. We're going to take a 90-second break, and I look forward to talking to you again real soon.
Oh, my name is Jared, and I had a liver transplant. My wish was to go to Dinosaur National Monument.
We had a wonderful time, didn't we?
I loved it. They had all different kinds of footprints from all different kinds of dinosaurs. I think there was a Triceratops and something else that was really large. Oh, that's a Stegosaurus. His brain was the size of a golf ball. We couldn't figure out what was what. Guess how large a Brachiosaurus's heart is? It's larger than me.
There was a time when we didn't know if he'd even be able to travel. So this, we enjoy watching him do everything.
Make-A-Wish is a nice place.
There are lots of ways you can help make a child's wish come true. To find out how, visit wish.org.
And share the power of a wish.
My lucky day.
The new Talk Radio 1450 WCTC, the voice of Central Jersey. The Garden Show with Peggy Ballister-Howells.
Hi, I'm Peggy Ballister-Howells, host of The Garden Show. Whether it's planting seeds in the spring, battling summer insects, planting fall bulbs, or tending houseplants throughout the winter, there's always a way to play in the dirt. Share your garden adventures with us Sunday mornings from 8 to 10.
The new Talk Radio 1450 WCTC, the voice of Central Jersey.
It's something unpredictable, but in the end is right. I hope you had the time of your life.
Hi, welcome back, everyone. This is Dr. Harry Schick, Natural Health Consultants at WCTC. I'm the director of High Point Health Center in Highland Park, New Jersey at Cleveland Avenue. I want to give you the number there if you want to speak to me at that location, 732-249-9800. And here, if you want to call in, it's 545-9282. We actually have a call on the line. Somebody wants to speak about something we discussed last week. So before going to the next topic, we'll talk about that briefly. Again, if you have questions about the blood pressure and the amazing things that I just told you, feel free to speak to me about that also. Hi, it's Dr. Schick. Can I help you? Hello.
Hello. Hey, Doc. My first question is on a drug-resistant fungus infection. Daniel Sittel, Sittel, on Google. He says, when you get to the hospital, we won't even treat you for the flu or your current health condition. You can hear us talking about it in the caption that says Guzman. In the Chicago backdrop, he says there's enough on the tapes you will have to flee to Brazil or false arrest me in order.
Okay. I appreciate the calls. We want to stay a little bit quicker and a little bit more on topic. So if anybody has something to speak about, you can call me here, 545-9282. If you have a more involved question like that, feel free to reach out to me at my office, either by phone, 249-9800, or you can email me at drschick317@gmail. So we talked so far about blood pressure. The next thing I want to talk about, which I thought was going to be a great topic today, but as I walked outside this morning to come here in only my shirt sleeves and not my coat, I realized it got a lot colder real quickly. But have faith. I think it's going to get warmer soon. So I want to talk to you about allergies because I know that as the season changes and it warms up, I get a lot of patients in because of allergies, and I got a lot of questions about allergies. So I want to give you an idea a little bit about allergies. First, understand a bit about what allergies are. So let's say you're walking down the street and you see somebody coming to you, harmlessly walking your way, who maybe you recognize you've seen before, and you see them, and you start shrieking and yelling at the top of your lungs, "Well, what are you doing here? I can't believe you're here. What is going on here?" And the guy says, "Why are you overreacting like that? You know who I am. What's the big deal?" And that's pretty much what an allergy is. When you come in contact with something, which actually for most people is very friendly, not that big a deal, but your immune system overreacts to it and goes crazy, that's an allergic reaction. An allergic reaction is when you have an overreaction of your immune system to something which is not toxic. For example, maybe you can't eat eggs, but other people in your family can. Eggs are not the problem. It's your overreaction. Same thing with pollen. When the pollen season starts, and I know here on CTC they always tell you the pollen count. When the pollen season starts and you walk outside, your neighbor may walk outside, take a nice deep breath, pick up the morning paper, and go on with their day, whereas you all of a sudden for some reason start coughing and sneezing. You're in the same atmosphere, it's the same pollen. Some people react, some people don't. The other thing about allergies that a lot of people don't realize is that there are all kinds of reactions. I have people coming in sometimes, and they may have a skin eruption, or they may have suddenly they have confusion, or they're feeling more fatigued, or even affects their digestion. And I tell them it could be allergies, and they're only thinking allergies has to be if you're congested or your eyes are watering. So your body can have a reaction to pretty much anything, and it can affect, because it's the immune system, it can really happen in any number of ways. So here's how I want you to think about allergies. I'm going to pick a number just to pretend. Let's say we pick the number 50. So let's say that your body can have up to 50 points of stimulus to something that you're allergic to, and you'll have no symptoms. For example, let's say eggs are a 35-point reactivity to you. You can eat eggs because eggs are not over 50 because they're only 35, and you go through day after day eating eggs, and you'll have no problem whatsoever. But let's say pollen is worth 20 points of reaction to you. Okay? Now, you had your morning eggs, 35. You walk outside to the pollen, 20. Let's add it up together. 30 plus 25 is 55. Over 50. Now you have the reaction. And this is very confusing for people because I have a lot of people come in saying the pollen is getting to me, especially if it's somebody new. And I say, well, I want to see what you're allergic to. They say, hey, I know what I'm allergic to. It's pollen. And the truth is, for some people, pollen will put them over 50 in and of itself. But I find for many, many people, it's other things that raise their floor up so that they're so reactive because they're reacting to other things. So when I tell them, hey, look, let's check corn, and we find that corn reacts to them, they go, but I eat corn all the time. So I explain to them, just what I'm explaining to you, that corn may be under 50 points, and it isn't until you have something else. The other thing that's confusing for people is that some things you react to right away. Some things people react to immediately. Some things they react to maybe in an hour. But there's a type of reaction that's actually next day. So somebody will come into me and say, you know, I was terrible today. I think it's the tomatoes I had for lunch. And I say to them, well, have you had wheat? They say, yeah, I did. I had that yesterday. Well, wheat, for example, may cause a reaction to somebody the day after. Depends on your own immune system. So it's just a little bit tricky to figure it all out. So there's a lot of ways, of course, to get allergy testing done. Common ways are people do blood tests. Some people do scratch tests on their skin. I'll tell you the number one way that people can know for sure if they do have an allergy, and people don't like this, but it's actually if you don't feel good when you come in contact with something or if you eat something. Now, I know I told you some things could be the next day, but I have people come to me and say, you know, I took a blood test, and the doctor told me wheat was fine, but every time I eat wheat, I get sick. So I keep eating it because I was told that it was fine. And I tell them, just as I'm sure that if they went back to the doctor who told them it was fine, would tell them, the number one way to know you're reacting to somebody is if you have an immediate reaction to it. So if you think you don't have a pollen allergy, but you go outside and the pollen is high and you start sniffling and coughing, you have a pollen reaction. The best way to know and the best way to tell is by what your own body is telling you. But again, it's not foolproof because you could have a reaction the day after. So sometimes you'll get blood tests done. There's all kinds of ways to do that. There's all kinds of kits, all kinds of different reactions that doctors might measure. You could get a skin test done. Sometimes people will actually do a pulse test. They'll have you put a little bit of the food or reactive. They can even do it with pollen or weed. They'll put a little bit of a dilation into your mouth and check your pulse 30 seconds, a minute, or 2 minutes later and see if you have a sudden rise in your pulse rate. So there's a number of ways to tell, and unfortunately it's not foolproof. And I know that if I had a round table of allergists here, they would not all agree as to how to find out. So there's ways in our own office that we check it also. We found an amazing thing, which is a technique that I learned back in 1999, actually, that if we find that a person has a strong muscle and we put them in contact with something that they're allergic to, either a food or an outdoor allergen, or sometimes I have to tell you a quick story. I remember that years ago I had a patient who said to me, I helped her and her family with many things, but she said to me, "Doc, there's one thing I want you to help me with. There's one thing I really want to do. I really want to do this." I said, "Okay, tell me, what is it?" And I remember clear as if it was yesterday. She said, "I want to go to Loehmann's." So I knew that Loehmann's was a clothing store, right? I think that's the name of it. I don't know if they're still open. It used to be down on Route 18. I said, "It seems funny to me. You want to go to Loehmann's. You need directions. What's the problem?" She goes, "No, I walk into Loehmann's, and there's so much wool in Loehmann's, I immediately break out when I walk into the store." So she had a wool allergy. So I said, well, let's find out. And I did exactly what I was just explaining to you. We put a little bit of wool in her hand. We did a muscle test for her, and sure enough, not to any surprise, she immediately showed weak with that. And then we applied a technique called allergy elimination technique, and which we had to do for a few sessions. But sure enough, she came in one day, not only having gone to Loehmann's, but came in wearing wool because she was no longer reactive to it. So there's amazing ways to do things like this, and we see this in the office all the time. People who can't have dairy, people who can't eat corn or whatever it is, and we go through this muscle testing technique to find out exactly what it is. But back to the original point, I love telling that story. Back to the original point, which is that when allergy season comes, it's a great time to get retested and to find out if you have food sensitivities, even though you may not have those the rest of the year. Because, again, to explain what I was saying earlier, that if you have a reaction to wheat, and wheat is worth 40 points, and pollen is worth 15, wouldn't we want to help you with the wheat reaction and lower the floor so that you can then go outside and be exposed to pollen without a problem? I've seen this day in and day out in my office. It's an amazing way to do it, and it really works superbly. So as allergy season comes upon us, I want to let you know that there are alternatives. And again, I want to let you also to trust your body, that if you're experiencing a reaction to something, and even though you had a blood test or a scratch test or some kind of test to say that it's not a problem, you can certainly trust yourself. Just to add in one other problem, as I'm sure most of you have heard of the idea of many people being reactive to gluten, and it's a huge problem for reasons we'll go on about in another week. But I want to dispel one notion, since I'm talking about allergies, about gluten. So when people go get a blood test for gluten, they go to one of the major laboratories. Those laboratories test them for 3 or 4 aspects of the gluten molecule, and many people come back and say they're fine, they don't have any reaction. Well, those blood tests are based on our knowledge of gluten back in the 80s and the 90s, and we know now that there are anywhere from 18 to 21 different protein aspects of gluten that can cause a problem. So if you've been told that your gluten reactivity is fine, but you still feel that you do react to wheat or other gluten foods, trust yourself. And if you're interested, we do other more extensive types of gluten testing using other labs and other types of saliva testing. And if you're interested, you can give us a call over at High Point Health. So those are some things to be thinking about. In our second segment, allergies, I know, can really disrupt your life. And if we can be of help to you, let us know. We're going to take a little break now. We've discussed blood pressure. We've discussed allergies. come back, and we're going to come back, speak in a few minutes about one of the most asked about topics of all time. I'll see you shortly.
This heavyweight bout is about to begin. The challenger wears white trunks with a blue stripe, and the champ is wearing, looks like an examination gown from the doctor's office. And from the back, we can... Ooh, that's not pretty. Champ, what's with the crazy getup?
I've got to take care of my family.
Yeah, so?
Well, when you love your family, you got to go in and get those important medical screenings. A lot of potentially deadly diseases can be treated if you catch them in time.
So you wear the examination gown because...
Because I'm a real man. Real men take care of their families and get those tests. Real men wear gowns.
Okay, champ, good luck. Here we go. The champ's not wasting any time. Oh, it's over. This fight is over. Champ, you barely broke a sweat. Any words for your fans out there?
Remember, go to ahrq.gov for a list of the tests they need to get and when to get them.
What was that web address again?
ahrq.gov. And remember, real men wear gowns.
Go to ahrq.gov. This message brought to you by the U.S. Department of Health and Human Services, AHRQ, and the Ad Council.
Live on Sunday night, it's Bill Cunningham.
Bill Cunningham here, the Great American. Every Sunday night live, a small band of renegades form around radio. From Maine to Hawaii, from Alaska to Florida, and all places in between, to talk about the issues of the day. This Sunday night live, we talk about what was and what lies ahead. Bill Cunningham, the Great American. I am a Great American, live with you every Sunday night.
Willie.
Sunday night at 10 on the new Talk Radio 1450 WCTC and WCTCAM.com.
It's something unpredictable, but in the end is right. I hope you had the time of your life.
Hi, and welcome back. It's Dr. Harry Schick, High Point Health Center in Highland Park, New Jersey. Thanks for listening, whether you're in the car, whether you are working or just at home. You know, we have people, thanks to the wonders of the Internet, I got a couple of people contacted me. I have 2 or 3 people down in Florida and somebody in North Carolina listening in. So wherever you are, whether you're on Facebook, I'm waving to you, or just listening in, I really want to welcome you. It means a lot to me. This is my favorite thing to talk about. If I can share information that will have a good effect in your life, for the life of your family, it means the world to me. For those who know me, know I work a lot, and I work a lot because I love working and I love helping and being out there. So this is a great opportunity, and I appreciate WCTC for giving me the chance to do that. As I spoke about earlier when we talked about blood pressure, I said there was a third component of it, and that third component has to do with mental health. I think we all kind of have the idea that under increased stress, our blood pressure can go up. With me now is Honey Sturzer. Good morning, Honey.
Good morning, Dr. Schick.
And Honey, as if you were here last week, you know we work together in the office in Highland Park, and she is our mental health expert. She runs the neurofeedback and does counseling and therapy in the office, and we're going to talk a little bit about stress and the effects of stress, and particularly the idea of how it can relate to blood pressure. So I want to give you a brief idea of a way to think about stress, and then I'm going to have Honey chime in with a couple ideas also. So the way that stress affects blood pressure is that we have 2 parts to our nervous system. We have what's called the sympathetic nervous system and the parasympathetic. So don't worry about the names. I mean, you can think about them if you want, but I want to give you what I think is a great explanation to how to understand those 2 points. So let's say it's a beautiful day, about 15 degrees warmer than it is today, and you're walking outside, you have the day off, sun is shining, you're whistling a happy tune, maybe singing the song from Green Day that I love so much, and just having a good time. You're about to meet a friend. You're walking down the street in your hometown, and you're just thinking, well, it's nice out. I'm having fun. You go to cross the street, and you hear tires screeching from the side street as a car is going to come screeching around the corner towards you, and you have to get out of the way, obviously, as quickly as possible. So when you're whistling a happy tune and walking down the street, that's your parasympathetic nervous system, which is in charge. It's like you're calming, relaxed, have a good day feeling. And when you hear that car screeching at you, that's your sympathetic nervous system, which we also know as your fight or flight mechanism, which comes into play. Now, the way I described it to you is a beautiful way for it to work, because that's exactly what's supposed to happen. But unfortunately, many of us live much too much of our time in the sympathetic nervous system, as if cars are screeching at us all the time. And we want to find a way to get more into the parasympathetic and not be so reactive all the time. Isn't that right, honey?
It sure is. We would all feel a lot better.
So there's different ways in which we can do that. I know that there are techniques in breathing, for example, that really help to stimulate the parasympathetic. Again, remember, we want to be more in the parasympathetic mode unless a car is coming at us or unless a lion is charging us. But otherwise, we should be living more parasympathetically and more calm. So there's some breathing ideas that really help with that.
Well, that's true. And I just wanted to touch on the point that you were bringing up before in terms of the foods. So you mentioned that you could actually check your pulse after you eat something.
That's right, yes.
And if it goes up, then you know that you're reactive to that particular food. So think about it. When a car comes screeching at you, what happens to your pulse in that moment? It's going to be going up. I'm sure all of us can recall a time when we got scared and our pulse went up. So imagine when that happens, when we eat something that increases our pulse, is actually kind of sending a message to our brain that there's something dangerous happening. So I think it's super helpful for us to be mindful that the foods that we eat actually affect our mental health and our state of mind.
Right. So you're saying we eat a food that increases our pulse rate, it also has an effect on increasing our sympathetic or our fight or flight mechanism.
Absolutely. And when that happens, we're not feeling really good. So when we think about anxiety and depression and all of those kinds of situations and feelings that we really struggle with, and we think about the foods that we eat and how it impacts our brain, and we track that, we can actually help ourselves feel better by staying away from foods that are triggering for us.
Yeah, I know we see in the office many times people will say, I have got a great life, I've got a great family, I have a good income, everything is fine, but I feel like I wake up in the morning looking for a problem, like my brain is seeking, what's wrong? And if I can't find anything wrong, I'll make something up. I'll try to find a way to create a problem. And a lot of times that can be to what a person ate that morning. It just makes them so irritable.
Right, it's just amazing to me when we do brain maps or QEEGs. I know we touched base last time that we were on the air with regard to neurofeedback. When we do a brain map, we can see very often signatures in terms of the way the brain map shows up that could be indicative of somebody having food sensitivities that could contribute greatly to anxiety and depression.
Right, that's great. I when I was thinking about what to talk about, I really wasn't thinking about the connection between the two. But really, you're bringing up a point which makes so much sense, that a lot of times the anxiety is driven not only by what's going on in the world, by what people eat.
Yeah, and it's a relatively easy fix in that regard, is to assess our lives from every aspect and look and see perhaps it's really a lot of physiology that's contributing to our anxiety and not just our psychology.
Right. I remember one of my favorite things when I went to chiropractic school back in the old days, they drew there was a triangle figure that they had, and one side it said the word structural, one side it said the word emotional, one side it said the word nutritional. That if we could balance somebody structurally, nutritionally, and emotionally, then we would really be making a tremendous impact on their health, which was lasting and significant.
And what I find so rewarding in terms of what we do in our office is that we help support the body and the brain in a connected kind of way, in a natural and holistic manner, and really help the body learn about itself and help the body to heal itself.
Right. And the thing that we were talking about in the beginning with breathing, I just wanted to give some ideas about that. And if you know me, you'll know that I'll be talking about this quite often, because I find that one of the keys to happiness is learning how to breathe properly. So you're thinking out there, well, I know how to breathe. This is not for me. Well, obviously, if you're listening, you know how to breathe. But unfortunately, most people breathe just enough to keep themselves alive. So I want to give you a couple clues now about the breathing process. So one of the things that happens when somebody, to take an extreme, let's say somebody has a panic attack. When somebody has a panic attack, unfortunately, what they're often told to do, okay, take a deep breath, calm down. Good, take a deep breath, calm down. Well, that unfortunately is the absolute opposite of what they should be doing. Taking a deep breath is not the answer to a panic attack. When somebody feels anxious or somebody feels panicky, physiologically they already have been over-breathing. They're like they get that kind of breath, right? So I hope that came across okay on the radio. They're getting too much oxygen in. The problem is that they are over-oxygenated. So when you are anxious or you are panicked or you want to calm yourself down, or after the car has missed you or the lion no longer decided to attack you and you got to the other side of the street and you want to calm yourself back down, the way to do that is not by taking a deep breath. You've been taking deep breaths to get you across the street. What you need to do now is what I like to call birthday candle breathing. Birthday candle breathing. So there you are. It's your birthday. You've got 39 candles on your cake. You take a breath in, and then you blow the candles out. And you blow, and you blow, and you blow until you get all the air out. That's how you lower panic, and that's how you lower anxiety, by exhalation. So the key in calming yourself down mentally, besides all the other things we've talked about with eating and so forth, is learn to breathe. It doesn't matter for this particular thing whether it's so much through your nose or through your mouth, but you take a little breath in and then you breathe out. And I tell my patients and I tell people, no, more. Breathe more out. Breathe so much more out that you feel like there is not a drop of oxygen from your toes to the tip of your head. Now, we've got a great piece of equipment in the office to see how you do with that. It's called a heart rate variability monitor. And we can actually see how the differential is between your breathing in and breathing out. But although we'd love to have you come in and we can show you an assessment of that, you don't need to do that. You can do that. You can start that right now. Take a little breath in and breathe out and breathe all the way out. And I want to tell you that, and even as I got a little nervous before the show today, what did I do? I did a little bit of birthday candle breathing. A little breath in and then breathe all the way out. And it's that breath out that really does that. And by the way, as a little side tip, that kind of breathing is one of the first, teaching that kind of breathing is one of the first remedies that's used in many countries. I know England and Australia, for example, and Russia, that kind of breathing out is a remedy used for asthma. Because we know that asthma also, in its true nature, even though asthmatics feel like they can't get enough breath in, the problem is that they have too much oxygen in, and breathing out more and more is really the key. They have to change their oxygen-carbon dioxide ratio. Mm-hmm. So I know that in the office we talk about that a lot and getting people to do proper breathing.
We do. And just to piggyback on what you commented before about being in sympathetic, which is being terrified and fight and flight, versus parasympathetic, relaxed, enjoying life. When we breathe in, we are kicked into sympathetic mode. And when we breathe out, we're in parasympathetic. So I think it would be great if all our listeners kind of play with this idea a little bit. In the office, I usually recommend breathing in to a count of 4 and breathing out to a count of 6 as you blow like you're blowing out a candle. So you're breathing in through your nose and out through your mouth. And you can try and see if you're more comfortable breathing into a count of 5 and breathing out to a count of 5, or breathing into a count of 3 and out to a count of 7. Everybody's comfort level is a little bit different, but just remember that as you breathe out, you're going into that parasympathetic calming state.
Thank you very much for that. This is Dr. Harry Schick here in this segment with Hani Sturzer. We are at High Point Health Center in Highland Park, New Jersey. You can reach us at 249-9800. We're going to take a break in a moment. I want you to exhale for the next minute and 30 seconds while you're waiting for us to come back. And we look forward to seeing you for our final segment, where I will begin discussing the most common asked question in my office over the last nearly 40 years. See you shortly.
If you're not facing your mortgage issues, this can be the most terrifying sound in the world. It means you've fallen behind. It means hope is dwindling. It means you're another call closer to losing your home to foreclosure. Fortunately, there's hope. If you need real help and guidance, call 1-888-995-HOPE. That's 1-888-995-4673. Because nothing is worse than doing nothing.
Brought to you by NHS of New York City, Brand New Day, RUPCO, MHA of Southwestern Connecticut, NeighborWorks, and the Ad Council.
Hi, it's Bert Barron reminding you to join me weekday mornings from 6 to 9 for Jersey Central right here on WCTC. In addition to 6 traffic and weather updates every 10 minutes on the 5s every hour, we have the top newsmakers, great Jersey, national, and international talk, great prizes, and more. Hey, if you're not listening, you're missing Jersey Hall of Fame radio.
Jersey Central with Bert Barron. Weekday mornings from 6 to 9 on the new Talk Radio 1450 WCTC.
It's something unpredictable, but in the end is right. I hope you had the time of your life.
Okay, welcome back for our final segment. So I had 2 questions come in over that minute and a half. One was why I refer to Honey Sturzer as Honey and not Doctor. And although she's not a doctor, I failed to give her amazing credentials, which she works so hard at. So I want to give those to you now. She's a licensed clinical social worker, a registered nurse for many years, and she also is nationally board certified in biofeedback and neurofeedback. So by way of introducing, she's also going to answer the second question, which I got, which is, what about the difference between breathing through your nose or breathing through your mouth? So listen carefully to this, and then we'll go into the final points for today.
So the reason we recommend breathing through your mouth with your lips pursed like you're blowing out a candle is because it helps to slow down the exhalation. Because the longer that we exhale, the longer we're in parasympathetic, and the better we feel. And the better it is for our heart, too.
Absolutely. Okay, so what is this big topic that I've been holding back for the end? So here it is. Ready? Doctor, you must help me. How can I lose weight? This question comes to me from people who are extraordinarily obese and people who I go, okay, I don't really see any fat on you. But I have learned over the years not to judge anybody who's asking me that. Everybody's got a right to want to lose a little more weight if they want. And I'm happy to help them because I know that among my happiest patients over the years are those who have lost weight and kept it off. So we're going to talk a little bit about weight loss today. I'm not going to solve the whole issue in the next few minutes, but we're going to introduce the topic, and we'll be coming back to it in future weeks because if it's important to you, it's important to me. It's important to me, not so much cosmetically, but it's important to me because, unfortunately, increased weight is a bad indicator for so many things, from blood pressure, like we spoke about earlier, to blood sugar, which we'll speak about in the future, to just pretty much everything. So what is this weight loss all about? What's the problem? Now, I mentioned last week that I'd seen the movie Apollo 11, and I saw this room full of 100 or so people filmed back in 1968 or 69, now I forget. I don't have those notes in front of me. All these people, none of them were overweight. So what has happened to us? So let's talk about weight loss. The good news is that weight loss is very, very, believe it or not, simple. That's right. Weight loss is very simple. Here's all it is. I'm going to explain to you now everything you need to know about weight loss. Ready? You have 2 types of hormones in your body. Hormones are messengers. You have messengers that are hormones that are fat storage hormones, and you have messengers that are fat burning hormones. Fat storage on one side of the scale, fat burning on the other side. So you've got this scale there. Which one do you want? So if you want to lose weight, you want fat burning hormones, and you want lots of them because you want to just burn that fat away all over your body. So that's the easy part to explain it. Now, if I had a pill that you could come into this office, to my office in Cleveland Avenue in Highland Park, New Jersey, and say, take 2 of these twice a day, these are fat-burning hormones, I would still be doing this show, but probably not from here. I would be doing it remotely from some beautiful sunny place. I love doing the show, but I might just be somewhere else because there are no such things as those pills. You can't take a pill to do that, and if I invented it, I would be thrilled to have done it. However, that's not my thing. I didn't do it. There are some medications that mimic that, but a lot of them have been outlawed, and they come with tremendous side effects. So all of the things that you have been told to do to lose weight are based on this formula. There are some things you've been told to do with the hope that this will increase your fat-burning hormones, and there's other things you've been told to do not to do because they will increase your fat storage hormones. So let's have a quiz. A big piece of chocolate cake with ice cream on top. Fat burning or fat storage? Raise your hand. Fat storage? How'd you get that right? That's correct. That will increase your fat storage hormones. Now, the old model of how to understand this was through calories. And if you've been doing weight loss for any length of time as a human being on planet Earth, you know it just ain't so. The calorie theory does not work. I don't know how many times I have people come into me and say, I don't understand this. I burn 3,000 calories a day. I eat 800 calories a day, and I keep gaining weight. It doesn't make sense. And I go, you're right. It doesn't make sense because that doesn't work. Counting calories. Now, a lot of times it will help people initially. I know that there are great programs out there that do that. But the reason that it works is not because of the calorie, but because they're reducing their fat storage food intake. And ultimately, those people plateau, and they need help to get to the next level. Like many people come, they've been on program X, Y, or Z, and they told me, well, it got me to here, but I can't get further. And that's when we have to go into the next steps. So that's an example of a chocolate cake with ice cream on top, and I love those things, particularly ice cream, but they are fat storage. So there are 3 basic food groups. There are, you know what they are? Because a lot of times I give people a food plan. They go, oh, this sounds just like this or it sounds just like that. Well, there's only 3 food groups in the world when it comes to this. There's fat, there's protein, and there's carbohydrates. That's it. So anybody who comes out with a diet is going to come out with some combination of those, and it's going to sound somewhat like somebody else's, unless they tell you only eat grapefruit all day or something like that. So everything is a combination of those things. Now, here's the bad news. The bad news is that things that you probably like a lot, which is in the carbohydrate family, like bread and pasta and things like that, it's all fat storage. It's just a matter of if it's a little fat storage or a lot fat storage. So there's a lot of good food in the carbohydrate family. Vegetables, for example. Vegetables are carbohydrates. I give my patients sometimes a diet, and they go, there's no carbs on this. And I tell them you can eat vegetables all day long. I go, yeah, the vegetables are carbs. I know what they're talking about. They're talking about pasta and bread. No, there isn't any on that for the most part. But carbohydrates, even good ones, like kale, which I find particularly disgusting to eat, but carrots or celery or any kind of vegetable like that, is not going to be fat burning. It's going to be fat storage, but to a very low level. So what else do we have left for fat burning? Well, we have protein and a little bit of protein. Now, when I say protein, and don't kill me if you're a vegan or vegetarian, I can't help it. I'm just reading you. I didn't make the rules, but I'm talking for protein here. True protein is actually an animal product. I'm not making a stance about it. I'm just telling you that protein comes from an animal product, which can mean a derivative of the animal product, like milk, or it could be an egg, or it could be the actual chicken or fish or whatever. if you eat that to a small degree, right, that is fat burning. Because think of it like throwing a log on a fire. You've got the fire of your metabolism, and when you throw a little protein on there, it makes the metabolism fire more, so now you get more fat burning. So you have a little bit of, you have minimal fat storage with the right kind of vegetables. You get some fat burning with the right kind of protein. And the last category is fat. Now, people tell me, and I don't blame them because it's a terrible name, fat. But fat is the only thing that no matter how much you eat will not create fat storage hormones. You can eat all the fat you want. I eat a lot of my diet is a high percentage of fat. Fat will not create fat storage hormones. So that's item number one. And we only have a few minutes left, so I'm going to get back to that, I promise. But I want to give you an idea about a tip that you can use to begin, regardless of what you eat. So an interesting study was done a while ago that people eat based on time. Certain people, they have dinner for 8 minutes. Other people have 15 minutes. Some people have lunch for 3 minutes. Some people have 7 minutes. But they charted people, and they found that unless it was some kind of a special occasion, of course, but generally their meal time was X amount of time. And they would eat whatever they would eat in that amount of time, and then it would be done. So I'm sure this is true for you, that your lunchtime and your dinner time is X amount of time. And as long as you're sitting there, you're going to eat. So what do we do about that? The study was not successful in getting people to eat in shorter amount of time. So here's the solution. The solution is, amazingly enough, chew your food. Now, I want you all to put your finger inside your mouth. Go ahead. And you'll find you have teeth there. Actual teeth inside your mouth. Now, these teeth can be very helpful in weight loss because the more you use your teeth, the easier it's going to be to lose weight because you're actually going to eat less fat storage foods. So the rule is the following. Chew your food 15 to 20 times before you take the next bite. Oh, I can do that. Oh, yeah? Let's see. Not so easy. 15 to 20 times. First of all, much better for your digestion. Secondly, you're going to eat in the same amount of time, and you're going to eat less. It's just the way it is. By the way, eating slower and chewing better will also give your brain time to register the fact of, hey, I'm full. Because people eat so fast, so much, that their brain doesn't get a chance to register that they are full already. So I gave you some ideas about weight loss. We're going to talk much more about foods in the future, but this is something you can start immediately. Check your mouth, make sure you've got your teeth in, and slowly chew your food. You can even chew quickly to get started, 15 to 20 times with each bite.
So, Dr. Schick, I'm really excited that we started this topic because we have an amazing program to offer to anyone who's looking to lose weight in a healthy way and in an enjoyable way. We have a specific eating plan and an actual piece of equipment which we can talk more about because we're running out of time today. But we look forward to having you join us on our program at Natural Health Consultants next Thursday at 10 a.m. so that you can hear more about what we want to share with you.
So thank you very much for tuning in. Thank you very much for reminding me of that. I get caught up in other things. We're at High Point Health Center in Highland Park, New Jersey, 732-249-9800. We learned a lot today, talked about blood pressure, talked about allergies, talked about mental health, talked about weight loss. And in future time, we'll add more. And I look forward to your questions during the week, either on Facebook or giving us a call, because I got all these ideas of things to talk about from you, the listeners. Have a wonderful week. And I want to tell you the things to take away for this week are the two main things I talk about. I actually have a book called What Else Can I Do? And the first two chapters are about breathing, and the second chapter is about chewing. Two of the most important things that you can do, which are free, by the way, ladies and gentlemen, boys and girls, breathing and chewing are free. Do it, enjoy, and we look forward to speaking with you next week.